Welcome to the deep dive. Today, let's get right into it. Health information technology, or HIT. Does it actually help patients get better? Or is it, more about the admin side? There's been some debate.
hmm
So we're digging into a big systematic review from 2018 by Cruz and Bean to see what the evidence really says.
Right. And it's important to remember, HIT isn't new. Bits of it go back to the 60s, mostly for finance stuff back then.
Ah, okay.
But this review, it really zooms in on the impact on actual medical outcomes for patients, more recently. We're talking health improvements.
Got it. So our mission here is to cut through the noise and see what the solid research shows about HIT's contribution to your care. First off, let's talk about how thorough this study was.
Yeah, the rigor is pretty impressive.
They looked at peer-reviewed studies, specifically between 2011 and 2017. The key was finding studies that defined an HIT intervention clearly
Right.
and measured its effect on medical outcomes, either efficiency, like saving time, or effectiveness, meaning, better health.
And the process itself, wow, they started with like over 3,600 papers.
That's a mountain of research.
It is, but they used really strict guidelines, Prisma and Amstar, which are basically the gold standard for these kinds of reviews, ensures quality, reduces bias. They managed to systematically narrow it all down to just 37 studies for the final analysis. Very careful work.
Okay, so after all that sifting,
Yeah.
what was the big finding? The headline?
Well, it's pretty clear-cut, actually.
Yeah.
The big majority, 81%, so that's 30 out of the 37 studies, they found at least one improved medical outcome linked directly to using HIT.
81%. That's pretty significant.
It really is. It strongly supports the idea, the hypothesis, that there's a positive link here. And it lines up with what earlier reviews were finding, too. It sort of confirms the trend.
Okay, so HIT seems to be working in many cases, but what kind of improvements are we actually seeing? What gets better?
Good question. They broke it down into three main buckets. The most common one, about 60% of the positive findings, was physical outcomes.
Physical, like what specifically?
Things like better blood pressure control, lower pain scores, fewer infections, improvements in daily living activities, even lower mortality rates in some cases, cholesterol, vaccination rates too. Tangible stuff. Okay, so real clinical improvements. What were the other categories?
About 20% were psychological outcomes. Think reductions in depression symptoms, less insomnia, people feeling more capable, sort of managing their own health. That's self-efficacy.
Interesting. And the last 20%.
That was continuity of care.
Yeah.
So things like patients sticking to their medication plans better, lower hospital readmission rates, shorter stays when they were in the hospital.
That covers a lot of ground. So which types of HIT were driving these changes? What tech was most common?
Yeah, they looked at that too. The most frequent category was web-based interventions that showed up in 21% of the studies.
Web-based, like patient portals or online tools?
Exactly. Things patients can access directly. Seems empowering them makes a difference. Then came telemedicine at 18%. No big surprise there, maybe.
Right, especially now. And then a broader category, just called software programs, that was 16%. Could be EHRs, decision support tools, things like that.
Okay. But it wasn't all positive, right? You said 81% showed improvement. What about the other 19%?
Right, important nuance. That 19% found no statistical difference in outcomes. But, and this is key, none of the 37 studies found any negative impact from HIT. No evidence it made things worse.
That's reassuring in itself.
Definitely. Though the reviewers were careful, they mentioned potential limitations. Like maybe studies with negative results just don't get published as often. That's publication bias.
Ah, okay.
And because the studies looked at different groups of people, different settings, you have to be a bit careful generalizing these findings to absolutely everyone, everywhere.
Makes sense. So thinking ahead, what does this mean for healthcare, for patients, for providers?
Well, it reinforces that HIT can be a really valuable tool, but it also points to where we need more research. Specifically, health information exchange, HIE. That's the tech that lets different hospitals or clinics share your info seamlessly. Crucial for joined-up care.
Yeah, that seems vital.
It is, but surprisingly, it only featured in one study in this whole review.
Only one. Wow.
Yeah. So clearly we need to understand the impact of HIE much better. That's a big area for future work.
So wrapping up our deep dive today, the evidence seems pretty compelling. Health information technology looks like it really is a powerful tool. It can improve medical outcomes, making care better and maybe more efficient for you.
Absolutely. And as healthcare keeps shifting towards, value-based care paying for quality, not just quantity, using HIT effectively is going to be essential for quality, for safety, and just for making healthcare sustainable.
Okay, so here's a thought to leave you with. We know technology is moving incredibly fast. Thinking about things like AI, advanced data analytics,
Mhm.
how might those tools transform patient outcomes even further down the line? And what completely new questions will that raise for all of us?